Hi, I'm Dr. Natalie Paxami. If you're dealing with leg pain, you might immediately think it's sciatica caused by a herniated disc. But here's the truth. Sciatica isn't always the result of a disc problem. In fact, there are several other conditions that can mimic sciatica, and understanding them is the key to finding the right solution. Today, we're going to explore the most common causes of sciatica, including Piriformis syndrome, disc prolapse, hip bursitis, and sacroiliac joint dysfunction. Jay and I will be guiding you through the differences between each condition and their unique symptoms. And in our upcoming videos, we will share targeted exercises that you can do right at home to ease your pain and strengthen your body. So make sure to subscribe and stay tuned. Now let's talk about the most commonly cause of sciatica, the disc prolapse, also known as herniated disc. This happens when the soft gel-like center of the spinal disc pushes through a tear in its outer layer. These discs act like cushions between your vertebrae, but when one becomes damaged, it can press on nearby nerve, including the sciatic nerve, triggering pain and symptoms. The pain usually feels sharp or shooting, starting in your lower back and going down the back of your leg. People often describe it as feeling like an electric shock. It can be constant or triggered by things like bending, lifting, or sitting for too long. Sometimes the leg might feel weak or hard to move, making it difficult to walk or keep your balance. But here's something very important. When sciatica is caused by a herniated disc, there is a numbness or tingling traveling below the knee and often reaching to the foot and toes, depending on which nerve is affected. But if sciatica comes from other conditions like joint or muscle problems, the pain usually stays above the knee.
One of the most overlooked causes of sciatic pain is Piriformis syndrome. The piriformis is a small, deep muscle located near the hip. It attaches to the sacrum bone, and the other side attaches to the greater trochanter of your hip. And the role that it plays, it helps with rotating the hip and stabilizing the pelvis area. In some people, the sciatic nerve goes through this piriformis muscle or beneath the piriformis muscle. When the piriformis muscle tightens or is inflamed, it compresses the sciatic nerve, causing symptoms like sharp pain, tingling, and numbness, and the burning sensation that radiates down the leg, often mimicking a disc herniation. Common triggers of this condition is prolonged sitting, especially on hard surfaces such as sitting on your walnuts, muscle weakness and imbalance, and overuse of from repetitive activities such as running, trauma, or changes during pregnancy that put extra pressure on that muscle. Understanding the Piriformis syndrome is crucial in identifying and treating sciatic pain that doesn't originate from the spine. Finally, let's talk about sacroiliac or SI joint dysfunction, another commonly overlooked cause of low back pain and leg pain. The SI joint, as you can see here, connects the base of your spine to your pelvis and plays a vital role in transferring weight between your upper body and leg. When these joints become too stiff or too mobile, it can lead to pain that often mimics a sciatica type of pain. People with SI joint dysfunction typically experience a dull, aching pain in the low back or near the back of the hip. The pain may worsen when standing for a long period of time, climbing stairs, or transitioning from sitting to standing. In some cases, discomfort can radiate into the thigh, though it usually doesn't travel below the knee. And recognizing the difference between true sciatica and SI joint dysfunction is very important for proper treatment and long-term relief.